pretty gross, eh? So, CAMH, what did I find out? A lot of really interesting things, actually. So, how do I want to start? I didn't talk too much about the youth gender program just because I feel like a lot of the individuals I talk to, they would be going into the adult program. So just a sort of overview in case any 18 or younger individuals are watching this, I think they have more resources as far as interns go. So there's a lot more support and therapy involved in the youth program, which is nice because you're young, you're trying to figure yourself out. The adult program at CAMH is more for assessment. So people who know how they identify are just looking to get the go-ahead from a government institution so that they can get their surgeries covered by OHIP. So that's the predominant difference between the youth and adult program. I think if you're a teenager and you're very sure of yourself, it's a good place. If you're a teenager and you're not very sure of how you identify and you're looking for some place to sort of help you negotiate that, CAMH may not be the best place. I think it depends on the intern you get. So I got a wonderful young woman who was very supportive, but I was also very adamantly sure about what I wanted in transition. So the adult program is more for assessing you as a candidate for gender reassignment surgery or to get onto HRT, hormones. In that respect, I'm going to say one thing about hormone therapy for guys. Dr. Zucker said that Dr. Bain operates based on recommendations from CAMH. So if CAMH were to say we don't think E-blockers are necessary and trans men can go right onto testosterone, if it's medically okay with him, then he wouldn't have any issue doing that. So I think trans men who are going to CAMH to get on HRT, I think that is something you should bring up, is that you don't want to be on estrogen blockers, you don't feel it's necessary. And then if you aren't sure and you want that sort of time, because what he was saying is it's more for the youth who they want to wait until they get to a certain age, but the kids don't want to go through the puberty of their wrong gender, so they get the blockers. But it doesn't make any sense for me to get blockers if I've already gone through female puberty. I mean, there's no point, that you're not going to stop anything. It's all happened already. So that's a tip for any trans guy going through CAMH. So CAMH works off of ministry requirements. I think the ministry applies a working definition of gender identity disorder from the DSM-4. And what Dr. Brown was saying, which is nice to hear, is that CAMH has sort of grown and evolved, where it used to be they'd follow you for a year, regardless of how you were living, whether you'd been living in the role of your proper gender for 6 years, and then you went to CAMH to sort of get things covered or get access to hormones or what have you. They would still follow you for a year, and you'd have to show that you were living in the role, in your gender. And Dr. Brown said she found that difficult to justify to people, so it's switched to a very case-by-case basis for the adult program now. So you come in, you have your assessment, and someone else had a good YouTube video. I'll try and find it because they actually went through it maybe last year or fairly recently, and they talk about what happened and what they talked about. So, and then I brought up genderqueer and this trans enough phenomenon that's happening in the community, where people are raising awareness that you don't have to fit into these boxes to be able to call yourself trans, and how they felt about that and how they would deal with someone who came to them maybe wanting hormones but not wanting any surgery, or vice versa, you know, stuff like that. So she brought up this point of the case-by-case basis and just talking to the person, finding out what they want. It's up to them in the end, which is hard, like they are the gatekeepers. So, but something she said that I thought was really interesting is they're looking more for confidence in your identity. So if you are gender fluid, you identify as trans, but you don't necessarily want to dress very masculine, or you don't want to change your name, or you don't want to get surgery or go on hormones or any of these things, but you know how you feel and you're very sure of yourself, that's not really an issue. It's more when people come in and they are changing their minds and they're not sure what they want, and they're not sure how they feel. That is sort of when she would say, you know, I'm not sure you can move forward medically or surgically because you don't seem to be very strong in how you feel about yourself. Does that make sense? So CAMH is more the place to go when you're sure about yourself. They do have therapy, like you can get therapy there, but I think it's difficult, and the scheduling might be tricky because there are so few professionals there who have the time to do that. And I'm sure they could recommend people, and then you could go and see. Like Dr. Zucker recommended someone for me, and I went to see him, and it didn't work out too well. So, you know, like all this stuff, you don't have to stick with one person. You don't have to do anything. I mean, no one can force you to do anything. It's the big thing. Surgeries, let's talk about that, because there's some interesting things I learned. All surgeries are covered by OHIP if they're considered necessary, which is so arbitrary. Like, how can you decide what's necessary? So for trans women, that's penectomy and vaginoplasty. I think that's how you say it. Those are covered by OHIP. Things that they consider cosmetic are breast augmentation and facial feminization surgery. So neither of those are covered by OHIP. So you can go through CAMH and they will get your lower surgery covered, but not anything else. And then for trans men, all the lower surgeries are covered, so phalloplasty, vetoidioplasty, centurions, I think. I'm not very interested in down there, so I haven't done a load of research, but that sounds right. Top surgery, they cover the mastectomy, so basically the incision, and I guess some removal of breast tissue, but they consider the chest contouring to be cosmetic. So, and that's the more expensive part of the surgery, Dr. Brown was telling me. So if you went through CAMH and you got approval to get top surgery and get it covered in Ontario, if you went to, say, Dr. McLean, you'd only get a portion of it covered, and she was saying you'd still end up paying about $5,000 for the chest contouring. That's a little silly, I think. If you're a trans guy and you're considering chest surgery and you want to get it covered, send me a private message and I'll talk to you. Yep. Okay. So that's that. And then the ministry, I'm assuming it's the Ministry of Health, has also dictated that any surgery that can be done in Ontario should be. So if you can get a surgery done in Ontario, that's where you should get it, and that's what they'll cover. If you want to get a surgery and no one in Ontario can do it, that's when you can go outside. So I don't know his name, damn it. There's a surgeon in Montreal and he does phalloplasty. He's like the big guy in Canada who does genital reconstruction surgery for guys. So OHIP will cover you going to see him because there aren't any surgeons in Ontario who perform that type of surgery. And then to sort of expand on that, any surgery that can be done in Canada should be. So OHIP won't pay for you to go down to the States if you can get that surgery in Canada somewhere. Does that make sense? So what Dr. Brown was saying is all surgeons have their own techniques for downstairs. Someone's being disciplined. I don't know if you can hear it, but if they were my kids, you just hear a belt hitting bare skin. I'm kidding, right? You'll never know. That. Surgery. Every surgeon has their own technique for how they do phalloplasty or metoidioplasty or centurions. So there's a doctor down in Texas who does, I think she was saying the doctor in Montreal does the radial arm phalloplasty. So he takes skin from here and constructs a phallus, and whereas the doctor in Texas does an abdominal flap phalloplasty, I believe. And so if you want, if that's the type of surgery you want, OHIP will cover you getting it down there. They won't cover the cost. You have to pay your own way to get there, stay there, food, all that stuff, but they'll pay for the surgery, the operation, because you can't get it in Canada. So another thing I brought up was I mentioned someone was talking to me about flying overseas and getting surgery because it's significantly cheaper, but he's living in the States, so it's a different situation. What Dr. Brown said to me was, if you are flying overseas to get bottom surgery, it's very wise to, how can I put this? If you're not financially secure, and if you know you can't afford to go back to that country where you got the surgery, if any complications should arise, and she was saying complications often arise, and it's still quite unavoidable. Like, there's still a lot of issues with phalloplasty, which is why I'm not interested in it. Because, it's too much hassle. The reason for that is because the surgeon overseas will have his own technique, he'll have his own way of doing things, and when you come back to Canada, the surgeons here won't know how to fix it, you know? Like, they're very specialized in what they do, and she was saying a liability issue because no surgeon would really want to go in and try to fix the problem and risk getting sued because the problem wasn't fixed or what have you, right? Liability and a lack of knowledge of other surgeons' techniques, and so it's very complicated. So it's better to go back to the surgeon who did the surgery the first time, because they'll know what they've done, where things have gone, like all that stuff. If you are considered a risky patient, either due to weight issues or smoking or anything, there is recourse. You can come back to CAMH and they can put in an application to see if you can go down to a doctor in the States who works with patients who are more risky. It's not an automatic guarantee of approval that you'll be able to get surgery, but there is that option. Like, you're not cut off right away if you don't meet the surgical requirements.